Hey, what's up guys? It's Victor from Cyborg for Life. I hope you guys have been really well. Now today I want to talk about something that I call the Sinister Six, the top 6 most worrisome aspects that a lot of people have surrounding limb lengthening surgery. Now I compiled this list from a lot of the questions that I get on a daily basis, and I ranked them from 1 to 6, and I did it as a way to help everybody think about a lot of the crucial aspects that go into the procedure, okay? So without further ado, aspect number 1 is going to be height. How much height can you gain from limb lengthening surgery? Well, it's no surprise that this took the top spot as the most popular concern that everybody has, and it's completely understandable. I mean, you're not gonna go in and break your legs and pay a ton of money, if you can't get noticeably taller and improve whatever area of life you want to, like your career, your relationships, your social acceptance, whatever it is, okay? So the best way to sift through this aspect is to basically say, how tall am I now and how tall would I like to get? And then you gotta add in reality. And what I mean is that, let's say that we take somebody who's 5 foot 2 inches and they want to get to 5 foot 7 inches. That's a 5-inch gain. Okay, fine. The bones can do this no problem. The culprit of resistance is going to be the soft tissues. Things like your muscles, your fascia, your tendons, your ligaments, your nerves. All of this is going to dictate how much length you can get safely. All right? So my advice is to basically set a goal, but be very observant along the way and be mindful if you have to change that goal, right? So let's take that 5 foot 2 inch person, and let's say they want to start with femur lengthening and go for the full 8 centimeters or 3 inches with the internal stride nail. They're going to consult with their surgeon and they're going to check with the physical therapist along the way to make sure they can get through it. Let's say they achieve it. Fine. Then the recovery process begins. Now they got to basically let the bone heal. They got to rehab. They got to regain their range of motion. They got to, make sure they perfect their walk. Then they got to get their device removed, and then they got to go through a shorter rehab, a shorter rebuild, and then they got to, heal up fully, and then they got to say, is enough, or do I want to consult with the surgeon and get round 2 done? Let's say that they want more height. So they consult with the surgeon again, and they say, I want to go for the tibias and go for the 5 centimeters or 2 inches there to get to the 5 foot 7, because let's say they're at 5 foot 5 right now. Fine. So now they're planning to do the tibias. Now, during either one of these lengthenings, whether it be the femur or the tibia, if they're lengthening and they get very, very tight, they may have to slow down their distraction rate or stop it altogether. Okay, so you've got to understand that those soft tissues are going to really provide a lot of resistance. And, so that's why it's really important that you stick to your physical therapy and all that rehab. So aspect number 2 is going to be money. Stature lengthening is by far the most expensive cosmetic procedure, and I don't think it's even close. But I think it's less of an expense and more of an investment in your happiness. But even then, it's pricey as heck. So now I think if you're going to invest in this procedure, there's 3 main points you need to consider. 1 is going to be the surgeon and their experience level. 2 is going to be the type of device and technique you're going to have used. And then 3 is going to be your living expenses and a potential complication fund you want to have saved up. Okay. Now, if you can get a medical loan to help you pay for the procedure, then great. But if not, then personal savings is going to be the only other method. Okay. And I don't want to go too deep in this topic because I made other videos on how to, pay for the surgery and how much it is and all that. But I do want to talk about a topic that, a lot of people have asked recently, and that is, do I think that the price of the procedure will go down? And my answer is maybe. I hope so. I mean, if more advanced tech comes out and it makes old tech obsolete, then that might be an option. I mean, look at what happened with the externals versus the internal stride nail. The price differential is crazy. So that might be an option. But then you got to look at things like market demand and other economical terms. So we'll see. Time will tell. So until then, I really hope that the price does drop so that people who really badly need or want this procedure to help cure their psychological pain can get it done. So we'll see. All right. So number 3 is going to be proportions. Will lengthening your legs skew your proportions in relation to your arm span and your height? To be brutally honest with you, yes, it will. Will it be noticeable? It depends, but I don't think so. I think that if you wear normal clothes and you're in your normal everyday life, I don't think anybody's going to really notice if you just do, lengthening the tibias or the femurs, one or the other, not both. Then, unless they have a very trained eye, which is a very small percentage of the population. I think it's like 2 to 5% of people who can recognize symmetry on site. Or your proportions weren't normal to begin with. Now, if you do the other segment, or if you do tibia lengthening after femur lengthening, then you walk a fine line. But there is a test you can do. You can stand in a full-length mirror, and you can test if the base of your palm meets the bottom of your pocket. And if it does, doing 3 to 5 inches meaning 1 or 2 segments of leg lengthening, your hand will still fit in your pocket and nobody really will think anything out of it. They won't bat an eye. However, if right now your hand is at pocket level, like it just fits in your pocket, and you do 3 to 5 inches and only your fingers fit in your pocket, that may turn a few heads. And then you may want to consider not going for as much length, or some people say go for arm lengthening, which I don't recommend. Then that could be that scenario. However, a lot of people have normal arm length and they usually fine for anywhere from 3 to 5 inches. But again, I'm not saying do all that. I'm just saying that that's a proportional thing, okay? And believe me, I have a trained eye. I mean, being a natural bodybuilder for over a decade, I mean, I know symmetry like the back of my hand. So I think that this is a good test. So you can definitely try it for yourself and kind of see where things go. Yeah, you can measure your bones all day, but it's more so how you look, okay, in the mirror, because that's how somebody's going to perceive you. It's not going to be like, oh, let me go measure your bones, because again, they're going to need an x-ray to measure all your inseam and all that stuff. It's about how you look on, do you look normal or do you look a little off? And if you look a little off, you can probably fix it anyway with a lot of little techniques. So aspect number 4, recovery, things like healing your bone, walking normally, working out intensely again, not having any long-term pain. All of this fall under this category, okay? So in quick fire fashion, when can you walk normally again? I don't know, 3.5 to 5 months. It's going to depend on the device you have, the person, how much rehab you do. What about working out intensely again? Usually 8 to 10 months. Again, depends on a lot of factors. What about no long-term residual pain? I'd say 2 to 3 years. Again, it's going to probably be way, way sooner than this, but I'm just giving you the maximum amount of time before it definitely has to be gone, or so there's something wrong. Okay, and all of this depends on the person and how consistent and progressive they were with their rehab and rebuilding progress. If they were, they're gonna have no problems, they're gonna have amazing results. If not, then there's gonna be a lot of problems, okay? So you really need to have a strong motivational reason why you're getting lengthening done to make a strong recovery program, okay? Because here's the thing, for me, it was to get back to the bodybuilding stage. I didn't know exactly if I was gonna get back, but I was like, I have to. One way or another, I just gotta get back, okay? So for you, if it's, career, you wanna, have better career opportunities, or if you wanna find a significant other and, have a relationship, or if you want to just be less scrutinized and have, more acceptance in your social settings, whatever it is, you need to have that in your mind when you're going through your recovery and rehab, and it's gonna push you. It's gonna push you to be very diligent and consistent with it on a regular basis so you can get the best possible results, okay? Because you can't just go into your therapy session or when you're at home doing your exercises and say, oh, I'll do a little bit of this and a little bit of that. No. You need to have a very structured and regimented process where you're saying, okay, I'm gonna improve my range of motion for this amount of time. I'm gonna increase my strength and my stabilizer muscles for this. I'm gonna, work on my center of gravity and working on my new biomechanics at my new normal, which will only take about 6 to 10 months. If it's taking any longer than that, it's too long. You're wasting time. And then you need to figure out if your nutrition and your recovery and your supplementation and all of this is intertwined in a streamlined, progressive process. If it is, you're doing great. If not, you need to find that structure and get it together, because you have a time frame. I think it's like a 2-year time frame that if you don't regain all of this back, for one lengthening that is, then you could potentially end up with long-term problems. I knew that I had to regain my flexibility and my range of motion so that my muscles wouldn't scar tissue and get really, really hard and lock up, okay? Because I have to do front squats, I have to do lunges, I have to do heavy deadlifts, I have to do all that. And if I was tight in any way or anything like that in my kinetic chain and my posterior chain, I'd have problems, okay? And the same thing goes for you if you're an athlete. So your recovery should be way, way higher on this list, I think so. You gotta be fine-tuning your body and fully in sync with your physiology. Number 5, pain. All right, so I think that this is a huge fear factor that people have regarding the procedure, and it's mainly because they're going in perfectly fine and they're waking up from the OR with broken legs. And I think that that's what gives you a lot of the pain, within the first few days. And then, up until week 2 to 3, it's mainly because of the swelling, inflammation. So as long as you have a really good pain-killing regimen with the pills that they prescribe you and everything, and you work hard to reduce the inflammation, reduce the swelling, and promote healing, you're going to be in good standing by week 2 to 3. It's just have a drastic drop off in pain if you don't talk to your surgeon, okay? Because that should be usually the average time frame that people have a drop off in pain. And if you can't handle pain after that, you can continue to take your painkillers. But I like to go off of them by that time frame because I wanted to feel it. And no, I'm not some crazy psychotic person that likes pain. I just wanted to know what was going on with my body, and I didn't want to be masking it with any painkiller. It was very manageable after week 2, and I was able to handle it. Yeah, did I feel some dull aches and stuff? Yeah, sure. I mean, I have, you had a surgery, leg lengthening surgery, so definitely make sure that you're paying attention to what's going on, but try your best to get rid of the root, the cause of the pain, which is usually the swelling and inflammation, and then obviously tight muscles. So do your therapy, okay? Because you're going to definitely loosen that up, and you're going to feel great. Then your goal is to turn lengthening into a waiting game. And till you're done your distraction and heal the bone and then get back to your normal life. And to do that, you need to make sure that you're reducing the swelling and inflammation. Get rid of it, because when you break your legs, you're going to have a ton of swelling. Your legs are going to be humongous. Get them back down to normal size, and your body can function normally, and then stretch. Okay, and then everything's just waiting. Okay, so if you think 3 weeks of pain for a lifetime of happiness, you can't really beat that. All right, last but not least, and still making the top 6 is going to be potential things that can go wrong, and that is complications. Now, people are doing a better job at, following guidelines, learning about the procedure. I mean, that's why I put the channel together, to help, inform people about the surgery. But I think that there's 3 main things that you can do. 1, look into getting a good surgeon to do your surgery. 2 is going to be do your part and work hard at your physical therapy. And then 3 is going to be learning about all of the potential things that could go wrong, okay? Things like muscle contractures, non-unions, premature consolidations, embolisms, nerve compressions, compartmentalization. All of these things you want to make sure that you know about, because they are potential problems, but if you do, like I said, you picked a good surgeon and you worked hard at your physical therapy, it's like 1 or 3% that any of these things that can happen, okay? It can happen, but the chances of them happening is very, very little, okay? If you did those first two, okay? I mean, really, the only big complications that I ever hear about is people getting very, very tight. And that's because of the fact that they either weren't really rigorous on their physical therapy, or you're just gonna get tight regardless. And usually if you let time take its course and you're working hard and it can get fixed, you're gonna be okay. There's no complication there, okay? So that needs to be done, that needs to be said. And also needs to be said that people sometimes get complacent when they're during the distraction, even with the Stride now. You need to have some sort of walking assistance, like a cane or walker nearby, or walk slowly, because some people get comfortable, like, oh, I have Stride now, I can walk around. You need to be careful, okay? Because even Dr. Fran Guardo last week, she said that walking forces generate more load on the nail than standing forces. And it's completely true. If you're walking too fast or too forceful, you can have a problem. So take time till the doctor completely clears and you say you have enough bone cortices that are formed there to be able to walk without any assistance, or even you're able to start speed walking or jogging, okay? So yeah, and always have a small fund saved up for complications in case something does occur, because it's not covered by insurance, okay? So you definitely want to have that. And there is a 7th hidden one aspect, and that's going to be a strong mindset. You need to have a strong mindset to get through this procedure, guys. I can't say that enough, because of the fact that if you don't, it can get very, very hard very fast. You need to have a positive mindset too, because when you first start it, things are going to happen. You're going to get tight. You're going to probably feel nerve tingling. You're going to feel all these different things happening with your body because you just had your legs broken. You don't know what's going on. You have metal implanted into you. You're a cyborg. But what you need to do is calm down, stay positive, be in constant communication with your medical team and your physical therapist, work together in a collaborative effort, and everything will work out fine, okay? It will. You have to keep that up here, that it will, because I had no clue what was happening. The original Precise Nail had just gotten released 2011, 2012 when I had it done, and I didn't know what was going on, okay? So you guys are well informed, way better informed than I was. So you have no reason why not. You can't pick a good surgeon, you can't do your part on physical therapy, and you can't learn about all the potential complications, okay? And having a strong mindset to drive through, okay? You gotta have a strong mindset. Okay, guys, so go ahead and comment below. Let me know what your biggest concern is out of the top 6. Are you ready for each of these things? Because I don't think you should go through with limb lengthening surgery until you are absolutely checkboxing all of these off and say, I understand that, or I'm worried about that, but I can manage it, all right? Because that's gonna affect your mindset, which is number 7. You have to have all of these things put together to have a successful outcome. All right, guys, that's all I have for you today. I know it was a long video, but I hope you enjoyed it. If you did, hit that like button. Be sure to subscribe, and until next time, this is Victor from Cyborg for Life, signing out. Peace.